My name is Frank Rodriquez, and I joined FCS in 2008. Did my medical school at the University of Miami, where I'm originally from. I was actually born in Panama, but ended up in Miami for my high school, etc. So medical school at the University of Miami, subsequently stayed there as a chief resident for a year, and then moved on to Moffitt Cancer Center, where I did 3 years of fellowship before coming to Florida Cancer Specialist. So I didn't have a aha moment where I knew that I needed to be an oncologist. I really liked how complex the field was and how high intensity it was. While that's the reason I started down this path, the only reason I have stayed in the path or in the field is really the connection that you make with patients. You make a tremendous connection, and that human contact is unlike any other field, in my opinion. I can't think of any other medical specialty that has the type of human touch that we have the privilege in oncology. Our relationships with patients, my relationship with my patients, I feel is highly personal and can be very rewarding and at times very heart-wrenching. Everything I do thinking of how I would want to be treated if I was in that seat. It goes without saying that I treat my patients like I would treat my family. I think there's no other way. I do believe that people, despite me providing the advice that I would want somebody to provide for me, or despite me telling them this is what I would do if I were you, different people have different goals in life, and they may opt to go in a different direction. And I do believe in providing kind of the entire picture, right? These are your options. And this is what I would do. Well, I think that the important thing is that when you're hit with a diagnosis like this one, the initial reaction is fear, and that's normal. And I think people need to embrace that, recognize it, and start looking for information from a reliable source that can help that fear become informed. And more important than anything else, I think we have hope. Every day there's something that changes our field for the better. So I really strongly believe that in our lifetime we're going to cure this disease, and the only way to get there is through clinical trials and through continued efforts to expose ourselves to more information. So I think hope is ultimately our biggest weapon.